First written question is, when you ask the alienating parent, what needs to happen for you to tell your children that visitation with the targeted parent is okay, and the answer is, from the alienator, the kids don't want to see her, there's nothing I can do, she alienated them by her actions, she needs to change her behavior, and there's nothing that I can do. How do you handle this? How do you handle it, if this is an obsessed alienator? Obviously, an altogether appropriate question. And this is where you use a strategy that I call invoke the judge's name. And specifically, you respond in terms of, oh, I can see the problem here. And there's another problem, a more immediate problem. The judge has ordered that visitation will be reestablished forthwith. That is the order under which I am operating. Now, if you persist in a position of there's nothing you can do, you're making yourself a victim of divorce again. And you're letting the divorce process control you as you retreat into a hopeless position, telling me that your situation is hopeless. I don't think it's hopeless. You say to me, she needs to change her behavior. Okay, let's focus on that. Tell me, how does she need to change her behavior? What does she need to do to change her behavior? So at that point, you lead the alienating behavior into the alienating parent into identifying behavioral goals, and as the alienating parent begins to identify some behavioral goals, you applaud that parent's effort and progress. And if Skinner had it right, we should get more effort and progress. The key is, this hasn't been my decisions, it's the judge who issued the order, and I am but a mere servant of the judge. Next question. How do you suggest we use this series with parents who may have personality disorders, i.e. narcissism, etc.? I don't know if I want to think in terms of personality disorders. Just for a moment, let's get academic. DSM-3, published in 1980, established that an acceptable correlation coefficient indicating agreement between two or more diagnosticians was a kappa coefficient of 0.80 or above. Okay? In 1980, there were 2 field trials regarding diagnoses of personality disorders, and the kappa coefficients were respectively 0.56 and 0.65, demonstrating that for 1980 DSM-3 criteria, diagnosticians were unable to realize an acceptable level of diagnostic agreement when diagnosing personality disorders. Clinically, what does that tell us? Well, it tells us the diagnosis of personality disorders are too often all over the map. And someone might say, well, Campbell, that's 1980. That's DSM-3. Please, we're dealing with DSM-4-TR in the year 2011 with DSM-5 right around the corner. Can't you be more contemporary? No. No, and I may step on toes when I say this, but the American Psychiatric Association won't allow me to report updated data. That is to say, DSM-3R, published 1987, did it report inter-rater reliability data for its diagnostic categories? Nope. DSM-4, published in 1994, did it report inter-rater reliability data for its diagnostic categories? Nope. Consequently, do we know that the diagnosis of personality disorder can be made at an acceptable level of reliability and consistency across different diagnosticians? No, we do not know that. Now, let's move from academic research considerations to treatment considerations. Jay Haley used to say, with a twinkle in his eye, I don't know how to treat school phobia. School phobia involves many, many complex intrapsychic conflicts and a corresponding long-term reinforcement history. And those considerations are overwhelming to me as a therapist. And with a small smile, Jay would comment, but show me a kid who won't go to school. Now, I can treat a kid who won't go to school. I know how to deal with that. But school phobia is overwhelming. What I'm getting at is, if we make the term personality disorder prominent in our thinking, we can end up as very discouraged therapists because personality disorders are a huge pain in the butt to deal with. But if we can get past personality disorder and not emphasize considerations of deficit and shortcoming and look for what are this client's strengths. And once you can begin to identify the client's strengths, then you ask yourself, how can I build on those strengths? Consequently, if I'm dealing with a personality disordered individual and I think the individual is personality disordered, I'll take that information and I will put it in the back of my head. In the front of my head, I'm asking myself, what strengths does this individual exhibit, allowing me to build on? Okay. Next question, raising similar issues. Thank you. Expectations, demands, etc. are unreasonable because attachment distress is running rampant in the here and now. How come none of this is acknowledged to the client? Because, again, I'm not sure what to do about long-term attachment distress. I don't know how to intervene with it. I don't know if anybody knows how to intervene effectively in cases of what appear to be long-term attachment distress, and I am emphasizing intentionally appear to be. Other than clinical judgment, do we have any well-defined objective procedures for identifying attachment distress and its severity? I don't know of any. My emphasis here is, as I emphasized a moment ago, if I am thinking in terms of attachment distress as exhibited by an alienated parent, I'm not sure what to do. And instead of trapping myself into that semi-paralyzed state, I would prefer to focus on what are this person's strengths. What are the strengths that allow me to begin to constructively build? Or correspondingly, in terms of personality disorder, even if we're talking about a generally personality disordered individual, that individual's not personality disordered all the time. That individual will sometimes exhibit traits of being normal and well-adjusted. So then you need to ask yourself, what are the conditions under which this personality disordered individual exhibits traits of being normal and well-adjusted? In other words, it assists therapists in these circumstances to think behavioristically, to think in terms of B.F. Skinner and his colleagues who would talk about stimulus control. And here we're asking, what are the prevailing stimuli that elicit semi-normal, semi-well-adjusted behavior from this individual that we might otherwise consider as being personality disordered? Now this, give me a moment, because I haven't read this one before. Yeah. So regarding seeing both parents separately, do I understand you see the alienating parent first, then the alienated one? Yeah, the second one is what we can call target parent. You see the alienated parent, the alienating parent first, because he or she holds the keys to the kingdom. And you want to see what kinds of inroads can you begin to make with that alienating parent, and that's why you see that parent first. Then there's a second part about links. What do you do What do you do with a link who identified with the alienating parent because she or he lived the same thing and now feels alone in his or her cause? First of all, that's not a link. That's an ally. In other words, this kind of a circumstance that the questioner is describing happens with considerable frequency. So can you regard this person as a link committed to your agenda as therapist of reunification? No. This person is an ally of the alienating parent. Now, so you still have to deal with this ally, but we deal with allies and we deal with links differently. Deal with the ally in terms of, remember, having the alienating parent explain to the ally, I've been a victim of divorce and I made you a victim of my divorce, and I'm so sorry that I did so. Okay. And another question? Okay. Is it documented and or observed by therapists that when children return from a visit from the alienator parent, that for 24 to 48 hours consistently, the children's behavior towards the targeted parent is consistently verbally aggressive, disobedient, and emotionally fragile? It will happen. It will happen. Then the second part of the follow-up is this not to be considered an identifiable symptom of potential parental alienation syndrome? Yes, absolutely. without a doubt. Dr. Burnett.
Dr. Campbell, you're a very optimistic person. So what would it take to convince you that an alienating parent is not going to respond to the form of treatment that you've been describing? What would it take to cause you to give up?
About 6 sessions, approximately 6 sessions, where I cannot convert that alienating parent using the tactics that I use, the figure ground reversals, the emphasis on you don't want to be a victim of divorce. Moreover, assume that I've expanded the system by identifying links. And I've brought in links, and the links aren't making any difference. Under those considerations, I have to consider reporting back to the court saying more drastic measures should be considered. Okay? And I should have said this before. Bill, thank you for the question. That is, if you do this kind of work, you will have cases that fail. There's no way around it. This is the most difficult, challenging work any mental health professional can undertake. And the failures can begin to rip your heart out, leading you into self-doubt, leading you into questioning your own competence. And because of those hazards, doing this kind of work, you need a network, a professional network of support for yourself. You need to have colleagues and or supervisors with whom you can discuss these cases. Because if you're trying to do this kind of work all by yourself, the difficulties and the demands of this work will absolutely wear you down. It's one of the reasons why Dr. Darnell said yesterday, don't take on more than 2 of these cases at the same time. And I would say, you can consider more than 2 cases at the same time, but you better have a very good network of support available for yourself. Got to stand for the deaf person. Oh, that's a good idea.
That doesn't let me. It's been my experience that when children are exchanged, there's always a period of emotional disturbance to a certain degree, just from the process of exchange. How do you differentiate that from what you said before, that it's a sign of parental alienation?
When children are changed.
Like when they come back from their visit.
The way you distinguish is, do those behavioral changes dissipate after about 24 to 48 hours?
Oh, okay.
Okay.
That's an argument for having less exchanges with longer visits.
Exactly.
Next question. How do you sell the victim of divorce model to someone who is consistent and energetic in their alienation behavior? First of all, the wording of the question is altogether appropriate. It's perfect wording. We are selling. That's it. When I'm into the victim of divorce model, I am a salesperson. No way around it. So how do you sell it effectively? You sell it in terms of, look, let's consider these facts rationally. Divorce is one of the single most stressful experiences that anybody can endure. And get the data on, life stresses. and show it to the person that divorce is one of the most stressful experiences that you can undergo. And in 90% of your cases, you'll be able to say to the parent, and prior to this, you had no experience with this very stressful situation. So now you're dragged into a circumstance dealing with rules and regulations that are foreign to you, that are not easily understood, and interacting with a group of professionals who are borderline indifferent to your circumstances, despite the fact that you are struggling with one of the most agonizing circumstances in your life, and you really want to tell me that this hasn't bothered you? Do you really want to tell me that these circumstances have not victimized you? I can't believe that. I really can't. I think you're more realistic than that. And then there's an additional option that I didn't talk about this morning. In 1984, 1985, the University of Rochester, our training group in structural and strategic family therapy invented Dr. Snow. In fact, Dr. Snow was a mythical individual who did not exist. But in the pursuit of a greater good, we would sometimes tell clients things such as, I've consulted about your situation with Dr. Snow. And Dr. Snow is very, very impressed with your motivation and your determination to overcome these problems. Dr. Snow is a senior, very experienced, highly respected individual here in our clinic. How would you respond to Dr. Snow? Or sometimes we would flip it. We would say, Dr. Snow questions whether or not you're really motivated to change. Now, I told Dr. Snow that I think you are a highly motivated individual putting forth a good faith effort. But Dr. Snow is trying to tell me that you're pulling the wool over my eyes. You wouldn't pull the wool over my eyes, would you? And what you do with a mythical Dr. Snow is you send alternative messages to the client, creating a temporary state of dissonance where the client can reduce the dissonance only by changing his or her behavior. And as you learn to do it real well, there's one other consideration that you have to remember. Don't get caught grinning as you do it.
You've sold the model.
I need you to come forward.
I'll translate. By the way, I'm leaving in a few minutes. Yeah, do you want to come to?
I'm coming.
By the way, my only comment is, I just hope Dr. Snow doesn't get subpoenaed.
Thank you for indulging my handicap.
No problem. You sold the model. They're suffering. How do you translate that into stop doing all the stuff you've been doing? I guess those wouldn't be the words you use.
You've been doing all this stuff you've been doing because you haven't had any constructive guidance. You're surrounded by professionals. Now, your judge is an exception, but you're surrounded by many other judges, friend of the court, personnel, attorneys, and even some other psychologists, where your case is another day at the office. We don't care all that much. And this leaves you feeling abandoned, betrayed, and absolutely bewildered. And can anybody blame you for that?
They
Can't blame you for that. If I were in your circumstances, I would feel abandoned, betrayed, and bewildered. So what we're talking about here are specific instances of how you've been a victim of the divorce process. The divorce process has taken charge of you. Your welfare dictates that we change this around and that we reverse these processes so you take charge of the divorce processes instead of the divorce processes taking charge of you. And one of the best ways you could start taking charge is to identify and define very objective expectations for your ex-spouse. Let's clearly identify what he has to do. As you've been launching your criticisms at him, you've let him off scot-free. Let's challenge him. Let's challenge him to do the right thing. And more often than not, that intervention will work. Okay. One more question. And thank you very much.
My question is, when you have someone who's good at alienating, and they say, well, the children don't want to have therapy. They really don't want to be, they don't want to go through this. How can you do this? You know, your mother's making you go through this therapy. How do you get around that?
I respond in terms of, I'm with the kids. They shouldn't have to have therapy. The issue is, we want you and your ex to take charge in such a manner where you and your ex agree on what the kids should do, and you agree on what the kids should not do, and under those circumstances, you and your ex make joint decisions about the welfare of your children, and we clear out all the psychologists, all the attorneys, and all the judges, and you and your ex take charge of the kids. Okay. And then you may have to follow it up with the whole issue of the most enduring characteristic of parental effectiveness is parents who are able to agree with each other and express consistent expectations for the kids' behavior. Divorced parents are able to do this to the extent that the two of you continue to disagree. You will invite judges, attorneys, friend of the court personnel, and even the occasional kindly psychologist into your lives as dictators. And stop and think. Do we care as much about your kids as you do? No. Or you and your husband can reduce the frequency and intensity of your conflicts in your ex-husband, increase your capacity for agreeing with each other, and out of those circumstances, if you and your husband agree that at 6 a.m. every weekday morning, your child should stand on his or her head and whistle Dixie for 5 minutes. No one can stop the two of you from doing it. Okay. All right, thank you.